Yes, someone who knows all about the devastating effects of snoring is Marianne Davey. Now, Marianne, you learned the hard way how to deal with it. You set up the British Snoring and Sleep Apnea Association to try and help other people. But at its height, what effect did snoring have on your relationship with your husband, Alan?
Well, it can be quite devastating because, of course, for somebody who's got to listen to that snoring, you really don't get any sleep at all. So sleep deprivation in itself can be quite devastating.
And you couldn't even run out of the room?
No, we didn't have that luxury. We had 3 children at the time and therefore there was nowhere else to go, which is very similar to a lot of other families.
Sure, we're going to be hearing how devastating it can be.
And there are medical connotations to all of this, which is why we've got Dr. Lorraine Cole with us, our resident doctor. Lorraine, do you get many people coming to you with snoring problems?
I think lots of people are like Julia, they're actually quite ashamed of the fact that they snore, but sometimes they'll mention it in passing, and more men I think are coming in and telling us that they snore and asking for help.
Well, hopefully we'll be giving some help out today. We'll be talking to you a little bit later on. And if you do snore, you know somebody else who snores, or you have a problem and you want to know what to do about it, then do give us a ring here. It's 0800 600 600, our telephone number, open throughout the show. Or you can contact us via our website, which is meridiantv.com/lunchtime live. That's if you want to email us.
Yes. 41% of men are affected by snoring, I didn't know that, and 28% of women.
Yeah.
I'm proud that there is a sex difference in it because I was accused when I was pregnant.
Women don't like to admit that they snore.
No, but I felt that, you know, if I was pregnant I had a little bit of a leeway on it, yeah.
Okay.
But anyway, Marianne Davey has started the British Snoring and Sleep Apnea Association. She found out the hard way how to deal with it. This is the sound that almost cost Marianne her marriage. Gosh.
That is a serious one, isn't it?
Yeah, that's Alan.
Is that Alan, is
that's
it?
That's Alan snoring.
That is powerful.
That's normal.
Is it?
Now, how did your relationship actually suffer, having to listen to that every night?
Well, of course, when somebody's keeping you awake all night, you're not getting that refreshing sleep that you need. And you wake up bad-tempered, of course, and it's this sort of constant not having the sleep that makes you bad-tempered, that causes a bit of a strain on the relationship. And the unfortunate thing is the person that's doing the snoring really doesn't have any control over it. You can dig them in the ribs and say, for goodness sake, please stop snoring. But when they fall asleep again, of course, they're going to continue with the snoring.
And he wasn't the typical snorer. He was a young man in his 20s when it started. He was fit, he wasn't overweight, not a big drinker.
No, he didn't.
So you couldn't put it down to anything in particular?
That's right. So you could say, well, why does somebody like this have a snoring problem? And so we set about finding out what it was and what we could do about it. But this was going back 25, nearly 30 years, of course, and in those days, snoring really wasn't top of the list of the research, and most GPs didn't really know what could be done about it.
What was the reaction from your GP, incidentally, when you went?
Well, he was trying to be very helpful, but he didn't know anything about it, and therefore he really didn't know where to direct us to look for information. So that really spurred us into thinking, well, we've got to find out for ourselves, because the prospect of actually going through the rest of our lives with this dreadful noise was really quite daunting, especially when you're in your early 20s.
Lorraine, as a GP, do you think that, you know, doctors do know enough about the causes of snoring or the problems it causes within families?
Well, I think they see the backlash of it, yes, in, as you say, sleeplessness, really. We all become irritable when we haven't had enough sleep. But I think not enough people actually come and ask for advice. I think people partially think that snoring is normal. We all, you know, people on the beach lying there snoring away, you know, we don't look on it as extraordinary. And there are simple measures that can be taken, and you've discussed those. I mean, weight loss, for example. Obviously, as people get older and ageing, that's another thing that can aggravate it. Smoking and alcohol. I mean, we will all snore at some time during our life, whether that's because we've got a cold, our nose is blocked with hay fever. When we're pregnant, as you say, we're more liable to snore because we get nasal congestion.
But this sleep apnea side of things is actually more serious, isn't it? This is the British Snoring and Sleep Apnea Association. Yes. Tell us about that.
Well, we haven't actually even said what causes snoring. Snoring is really sort of tissues in our nose and the back of our palate flapping, and that's all that snoring is. The air comes through and we get the flapping noise, which is what creates the snoring. In sleep apnea, we actually get a block to the airway. Either your tongue can sort of sink back and you get a blockage, and it stops you breathing for a while. And we've all seen that and then the break in it with the breathing, and then they'll start breathing
And
again.
a great explosion as
Absolutely,
you come
as it's released. And
That was Alan's problem, I think, wasn't it?
Well, he doesn't suffer from sleep apnea as such.
But the tongue.
His problem is that the tongue drops to the back of the throat and it actually causes a blockage.
Right.
Very dangerous, I would think.
It can be if left unaddressed. It's usually the sort of thing that develops over several years. So if you've got a snoring problem, it's best to address it now rather than leaving it.
You see, you thought you were coming in to talk about your soaps today, but
No,
now you've
I'm
got...
fascinated actually, and I think it's great of you to be so proactive and to have actually, you know,
Yes.
sort of taken up the battle yourself. I think it's...
Well, there are so many people out there who really want help, and they until now they didn't really know where to turn. So now that we know all the answers, because we've spent many years researching it, they're coming to us for our help and advice.
Yeah, you brought some things on the table here that you brought in.
Yes.
Just describe it. Alan used a gum shield, actually, didn't he?
Yes,
Which one
he
was
does.
that?
He uses something like this, and this is really the sort of device that we're talking about for Alan's particular problem, and he has the tongue-based problem. Now, what it does, it's just a plastic shield that goes into the mouth, and if you can see here, the lower portion of it sits proud of the top half. So when it's actually in your mouth, it's going to bring your lower jaw forward, and because your tongue is attached to the lower jaw, your tongue will come forward, and what that actually does, that allows a lot more space at the back of the throat for the air to pass without it vibrating.
So most of these here are concerned with opening up the airways, really.
Well, this one is, and this is a very similar device, but of course this isn't. Some people suffer with snoring because they have maybe blocked nasal passages, or maybe even small or collapsing nostrils. And in this instance, this air can't get through the nose, and so everything is sort of trying to rattle around inside. So what we can do here, if we've got small or collapsing nostrils, this is just a little plaster strip, really, and it just goes across the top of the nose here, and it sticks on, and when it's stuck on, it actually just brings the nostrils open, and it allows the air to go through quite freely.
You're fascinated. Is that yours, that one?
I never breathe through my nose. I've always had sort of allergic rhinitis since I was a child, allergy to dust and cats.
Oh, right.
So I never breathe through my nose. So that would actually, I mean, the trouble is, I wear like lotions and potions. I look like Doc Cotton when I go to bed at night. I can't wear that as well. We're never going to have any fun, are we?
Well, the other thing you could try is if you are getting a sort of an allergy, obviously you can get swelling inside your nose with allergy, and so you can sometimes use the nasal sprays that will settle down the mucus inside your nose, and the mucous membrane will settle that down, and those can help, certainly for people that have an allergic component to it. And you can actually put that, squeeze that in before you go to bed, as opposed to having it stuck up your nose all night.
Thank you very much, Lynn.
Well, you can join us in our surgery here at Lunchtime Live, or Lorraine's surgery here, after the break. We will be talking later to all our guests. Join us in a couple of minutes.
Don't nod off, by the way. See you in a couple of minutes.
Stay with it.
Hello and welcome back to Lunchtime Live. We're talking snoring today, would you believe, with Julie Peasgood, who's joined us, and Marianne Davey, who looks after the Snoring Association, and also our resident GP, Dr. Lorraine Cole, is with us.
Yes, snoring can be incredibly loud. It can reach up to 90 decibels, which is about as loud as a fire alarm, will you believe?
Or it can reach this sort of pitch, which is the sound of, no, the alarm bell again, but this is the sign of a drill, would you believe? Which is a pneumatic drill. Thank you, Alan.
That's on a low power one, though, I think.
Yeah, but it's getting, you know, it's
You
got a bit higher.
recognise it.
Yeah. But I mean, that is serious, isn't it? I mean, 90
Awful.
decibels, that's the sort of level that people have to deal
Yeah,
with.
and it breaks up relationships, doesn't it?
It does indeed, yeah.
All right, we want you to call us on 0800 600 600, or you can email us via our website on meridiantv.com/lunchtime live. We do have a fact sheet going with today's topic, so you can get that either by phoning, writing to us, or emailing us, so that's worth having.
There's a lot of calls been coming in.
Yeah.
This is a lovely comment, actually. Beverly MacDonald has called from Bracknell. She said she was in the hospital and had to be released early because the patients were complaining about her snoring in the ward.
Another lady.
Another lady. Well done,
It's not
Beverly.
male specific, is it? Marilyn Richards' husband snored for 17 years, and 2 years ago he had his tonsils out, and she hasn't heard a snore from him since.
That's quite radical, though, isn't it, Lorraine, to have surgery?
Well, yes, I mean, surgery is really a very last resort in snoring problems, but obviously it's just cleared a bit more space for the air to go through at the back of his throat, but certainly not a first stage treatment for it.
Now, Julie, you're about to head out on a trek overseas, and I think this is a lovely line. This, I mean, you're going camping for the first time as part of this trek.
Absolutely, I'm heading a trek for Bernardos, which I'm very proud to do. It's a charity I support very strongly, and it's very funny. It's Trek Kenya, and later on there's Trek Ecuador and things. And they told me yesterday that I would be sharing a tent. You know, was that all right? And my immediate thought, truly, my immediate thought was, oh no, you know, I better be honest and say that might not be too good for whoever's sharing with me. So they might be fixing me up with a tent on my own.
And you actually had to admit to them that you snored.
I did admit to them. Well, why not? I couldn't
You've got
bear
to do it.
that
No,
person
come
with
out,
me.
girl. That's it.
It's the embarrassment, doesn't
But
it?
if anybody is out there and wants to sort of join the trek, you know, you can. I think the number's on the website.
It is. We have a number.
You might
there
even
as
get
well.
to be my partner and not sleep
But
at all.
stay clear of that tent. When you see the tent heaving around, you know whose tent it is. You know.
Oh, we've actually got a call, haven't we?
have, yeah.
Who have we got?
Who's on the line? Hello, Trevor. Is it there?
Yeah, hello.
Trevor, what, are you calling from Hastings?
I am, yes.
Now, Trevor, you've got a problem, haven't you?
I'm a serious snorer.
Right. Just how bad is it?
Well, I've often woken up to find my wife on the sofa downstairs, you know, in desperation for sleep.
Has this been going on a long time now, Trevor?
Sorry?
Has it been going on a long time?
Yes, I mean, it's got worse ever since I was in my mid-20s, you know. As I've got older, it's got worse and worse and worse.
And is it something that you've been to see the doctor about, or have you sought any advice from anybody before?
I haven't, to be honest, no.
So you've come on the phone today to get some solid advice here from Marianne and from Lorraine.
Is it getting worse, Trevor?
Sorry?
Is it getting worse?
Well, it's about as bad as it can get now, to be honest. I mean, it was louder than that tape that was
Oh,
earlier.
my goodness.
Marianne is all yours. It's Trevor.
Yes, hello Trevor.
Hello.
Well, I think the first thing we have to say is, unfortunately, as we do get older, everything relaxes more, and therefore we're more disposed to snoring, because, of course, all the muscles in the throat area relax, and that makes us snore more. But what I'd like to ask you is, have you put on weight in recent years?
No, in actual fact, I've lost weight.
Oh, that's interesting. And you say you've always snored?
No, it started in my mid-20s, and it's got worse as I've got. I'm 35 now.
Right, so probably it started when you'd had maybe just the odd drink or two, and the rest of the time it was fine, but it's gradually getting worse?
Yes, it is, yes.
Trevor, do you wake yourself up with it in the middle of the night?
Yes, I do. I mean, my wife has said, it looks as though I've stopped breathing.
Ah, so is this the sleep apnea thing we've been talking about, Trevor? You've been watching the show, have you?
Yes, I didn't know anything about it beforehand, though.
Should we ask Lorraine?
Yes,
what do you think?
As we said, snoring is a sort of range, really, and it sounds as if Trevor's at sort of the one end, really, and if he is starting to break his sleep pattern. Do you find you're tired during the day,
Yes,
Trevor?
but I very often wake up with a seriously sore throat.
Do you really?
Oh, yes.
So what does it look like he has sleep apnea then?
Well,
Lorraine?
it looks like he's obviously mouth breathing,
Yes.
and it may be that addressing the nasal problem, you may be getting some nasal blockage, Trevor, that may be at the root cause of it. So again, there are measures that you may be able to take that may help that.
What would you say he should do?
Well, certainly, I think it's worth trying. Well, I mean, you could pop along and see your GP, see if you've got any swelling in your nose, and certainly, as I was speaking to Julie about, you could try one of the nasal sprays if you were at all allergic.
I've tried that.
You've tried that, and that was no use.
Have you tried?
Not really, no.
I don't know about these, but I've been fascinated about them. Those pillows, there are special pillows that you can buy from various places that say put you at a different angle. Do they work?
Well, ordinary pillows, if you just have two pillows instead of one, might help. But certainly your problem does sound as if you've got some sort of allergy there. So it's important to find out what the allergy is.
Well, I suffer from hay fever.
Ah, well, this, you see, as Lorraine was saying, it could possibly be the fact that the lining of your nose and throat is swelling, which means you can't breathe very well through your nose. So what you're actually doing is breathing through your mouth, and this is why you're waking up in the morning with the sore throat.
Are you going to pop to your GP, Trevor, and find out whether there's anything he might be able to do, as
Well, I
Lorraine was
might well do
suggesting?
now, yes.
Yeah.
I didn't realise there was anything that could really be done, to be
Well,
honest.
this is the thing, isn't it,
Yes.
Lorraine?
I think that's what most people think, and
really.
certainly there may be something quite simple that will be able to sort your problem out. And if it's that intrusive, then I think it's worth asking for some help.
Trevor, listen, thank you very much indeed for that call.
Have a read of the fact sheet as well, Trevor. You can get that by calling our website if you want.
Well done.
Thank you very
Thank you
much.
for calling in. We've got a phone call here from Helen Watts. no, actually Kelly Newey, her husband snores only slightly, but her 2-year-old Rottweiler sleeps in the bedroom and the dog snores worse than the husband. Even the neighbours
Do you treat dogs
complained.
as well, Marianne?
Well, we don't treat dogs, but I can tell you why some breeds of dogs actually snore. What happens with some types of breeds, they have a very short, fat neck. And what is happening there, it's all this fatty tissue around the neck area.
It's like some men, isn't it?
This is correct. And it squeezes the airway closed and the air cannot get down into the lungs. Unfortunately, I can't offer anything to help the dog.
OK, well, listen, we've had great response about snoring, haven't
That's
we?
right,
as well?
yeah. Rebecca Hallett here says boyfriend keeps her up all night. Her son next door is kept up, been to the doctor and got tablets and they didn't work. What else can she do?
And don't forget, Marianne has a helpline as well, which you get the number from our website.
Yes,
so
what
that's
did you try
great news.
that,
Anybody who
yes.
needs that sort of assistance,
Yes.
that's fantastic.